As promised, guys, this is part 2 of laminectomy series, where I'm going to be talking about what a laminectomy is and the kind of diagnosis you will see that will lead to this kind of surgery. Okay, so here we go. So what is laminectomy? Okay, what I like to do when I was in school is to try to break down words, and that would help me to remember what they are. So the word we're looking at today is laminectomy. So what I like to do is I like to cut it down from the prefix and the suffix, okay? So the first I'm going to look at is lamina, right? L-A-M-I-N. And this simply means lamina. Now the lamina is the vertebral arch, which is the back part of the vertebrae, which covers the spinal cord, and it forms the vertebral arch, okay? That's the lamina. That's what we see when we look at pictures and we see that little pointy part that's sticking out. That's it, guys. The next part, ectomy, simply means surgical removal. So if you put the two words together, surgical removal of the lamina, okay? So that's really what I had. I had removal of the lamina in order to allow the nerves to flow and not be compressed. So the laminectomy surgery is simply just a surgical removal of the lamina. Now this can be complete removal of the lamina. This can be a portion. I wouldn't know. That's something you would have to speak to your doctor about. But usually your doctor wouldn't let you know if they're going to do a full lamina removal if you ask a question, or if they're going to do a partial lamina removal. I also had two other things that they did, which was decompression, which is pretty much, you know, what this is you're relieving the nerve. And I had something else also called foraminoptomy. I can never say that right. Foraminoptomy. Okay? I won't dive into that, but just another example on how you can break down words. I'm going to show you. Hopefully you guys can see this. So, F-O-R-M-I-N-O-T-O-M-Y. So foraminoptomy is simply, if I was to break it down, F-O-R-M-I-N, that means foramen. So foramen is just simply a hole, okay? It's a hollow passageway. O-T-O-M-Y, otomy, okay, which is different from ectomy. This simply means, and let me circle this one. This simply means to open, okay? So I also had this done, which simply means, again, to open the foramen, which means to open the hollow passageway or to open the hole, which again is another form of decompression. Now we're going to just dive into what people go through and why would somebody qualify for this kind of surgery. You will often hear about spinal stenosis. When we're looking at the prefix, again, if we're breaking down words, remember I talked about that before, we're going to look at this word right here, S-T-E-N, okay? And that simply means narrowing, okay? That means narrowing, okay? O-S-I-S, okay? That means condition, okay? So condition of the narrowing of the spine, okay? So someone that has spinal stenosis would be a candidate depending on the severity for a laminectomy. Okay, so from a coder perspective, which I am, or an OTR perspective, you simply need to know that spinal stenosis is the narrowing of the spine. D, degenerative disc disease. A lot of times you'll probably see this with your older population, your geriatrics, which is what I love to work with, is my old folks. I love my old folks. Older folks or seasoned. Sometimes people don't like to be called old. So I'm gonna call them seasoned folks. And this simply means that the cushion, okay, that is within the disc breaks down. Thirdly, you may have someone that has developed something called bone spurs. Okay, bone spurs is a simply abnormal growth or formation of bone on the spine, and this is also called bone spurs. Again, it's abnormal bone growth on the vertebrae. Fourthly is herniated disc. So this simply means it's a displacement of the disc. Okay, so the disc may slip, the disc may come out of place depending on how much millimeters it comes out. But when certain herniated disc happens, this can create something called sciatica. Okay, and like I said in series number 1, if you haven't watched it, you really need to. It is painful, and that is just simply compression of the sciatic nerve, hence sciatica. This is the longest nerve in the body that runs from the spine all the way down to your foot. Lastly, spondylosis. Spondylosis simply means osteoarthritis of the spine, which is wear and tear. So these are just a few of the diagnoses that I've covered. Someone else that may undergo laminectomy surgery can simply just be from trauma or injury, maybe a car accident or a fall. There's many different factors, but usually when there's a gradual buildup or there is over time wear and tear, you'll often see these kind of diagnoses coming, especially if you work in a skilled nursing facility. Okay, so whenever anyone is having a laminectomy, it is usually a day surgery, and certain precautions that follow, which we will address in the third video. But for now, you just need to know that it is a day surgery. So after your surgery, you'll probably get like sterile bandage. The cut is very minute, it's very small, so that's a good thing. We have definitely advanced in our technology. And also, you don't want to like jump into a pool and go swimming right away. You can take showers. Probably just don't let the shower head just sit on it, but you can take showers. No bathing, not yet. No relaxing in the tub. And when you are washing over it, definitely don't scrub. So please, if you have any more questions or you want a little bit more in-depth explanation, be sure to leave me a comment below, and make sure you subscribe and watch all of this video, because I will know, because I'm watching you. So be sure to tune back in with me for the next part 3, where I'm going to dive more into how to treat and interventions, and we'll even talk about documentation. Yeah, we'll probably talk about documentation a little bit. So how to treat, okay? Stay tuned.